Hello everyone, welcome back to my channel. It's your girl Kanyinsola. Hope you're doing very well today, and if you are new here, please subscribe. I make videos all about society, culture, politics, anything that I feel like I want to talk about, I'll talk about. And if you are coming back, thank you so much for coming back. So today, as the title will tell you, I'm going to be talking about my smear test cervical screening experience, because I feel like it's something that happens, but some people don't talk about it, or they're scared to talk about it, or they haven't experienced it yet and they want to know more. I actually did a survey on my Instagram where quite a lot of you were like DMing me about their cervical screening experience, or just asking me questions about my experience. I was going to talk about it on Instagram, but I thought, oh my god, this is like a lot bigger than just a quick little 24-hour snapshot on Instagram. Let me just make a whole video about it, and that's what I'm here to do. Yeah, that's what I'm here to do. Yeah, like I said on Instagram, I just basically said like I did my first cervical screening. I was joking about how I'm officially an adult. Obviously, a smear test or screening does not make you an adult. Other things make you an adult. And I said, you know, had anyone ever done it? Were they wondering? And quite a lot of people said that they were wondering what it was like, and they haven't really heard anyone talk about it. And I was actually telling my mum that I was going to do this video, and she was like, I do want to talk about that. And I was like, that's exactly why I'm going to do it. That's exactly what I'm going to do, mama. I'm going to do it because of that. Because I know that it seems ambiguous until you've done it. And I had my smear test last week. Yeah, last week. The thing about me is when I interact with medical professionals, I will ask them lots of questions. I will. I pay tax. I can ask. So I asked lots of questions to the nurse who I had. She was a very, very lovely woman, very warm and friendly, and was, I'm going to go into why it's good to have a good, you know, medical professional doing your smear test, because it makes all the difference in the world, in my opinion anyway, to whether or not you have a good experience when you have your smear test or you don't. Experience of the smear test, and also things I learned along the way. I'm under the age of 25, but they send you a letter in the 6 months coming up to your 25th birthday, and they sent me a letter in December, and I was actually quite excited about it because I felt like I've heard my mum talk about her experience, or like, actually no, it's only ever been my mum talk about her experience. The people I've seen, you know, people who have had cervical cancer campaign that it should be under the age of 25, and you're probably thinking, if you're someone who doesn't have, why did my accent go like that? If you're someone who doesn't have a womb, right, you might think, what does this, it doesn't have anything to do with me. But I still think it's important to know and be aware of, especially if you're a man that's dating a woman, if you are a trans man as well. It's just good to know for knowing sake. So what is a cervical screening? A cervical screening is just basically when a medical professional, a nurse or a doctor, will take a sample cell. You can access your cervix through your vagina. Okay, that's the entrance to the womb. And basically they just collect sample cells. It's not a test for cancer, it's more prevention for cancer. So what they're really trying to find is if you have a high risk HPV, right? HPV, I can't say it for the life of me. It's human papillomavirus. Can't say it, babes. I'm just gonna put the link down below. So HPV can be pretty normal, and where it can just resolve itself, but some cases, if it's high risk, it can turn into cervical cancer. So what they do is just check if you have any high risk cells of HPV. After they've taken the samples, you get the results in 2 weeks time, and they let you know the next steps, whether or not they don't detect anything, or if they do, they just let you know the next steps of what they're going to do for you, right? That's basically, long story short, of what a cervical screening is. It's just, like I said, it's just important to do this so you have like an overall awareness of your cervical health. So the cervical screening is, they do it between the age of 25 and 65. And I think for me, especially, I take my reproductive health very seriously, because I've had aunties that have had fibroids before. I know that there are certain communities that have higher risk of things like fibroids or reproductive health issues. So I'm just always on tip-top, like, just trying to make sure I'm okay. Is everything okay? Okay, good. That's just my mentality. So I was looking forward to it. And for me, before I continue, I want to say that my experience does not mean that's everybody else's experience. My experience might have been great, another person's might have been terrible, and I think there's so many things that play a factor into it, but the number one thing that I would say would play a factor into it is making sure that the medical professional that's going to be doing the smear screening for you, or the smear screening. The cervical screening for you is actually one that respects your boundaries and understands consent. Because I think when we talk about consent, we usually talk about it from the lens of relationships and, you know, sexual relationships, but we don't ever think into account like medical consent. Some doctors might think that because they have a PhD in medicine that they can now come and violate your body anyhow or not give you the privacy that you deserve. And I'm just here to tell you that you're allowed to set boundaries to people that might have more accolades than you. You're absolutely allowed to set boundaries. One of the things I really loved about the nurse that did my screening for me, and I'll talk to you through my whole screening process, is before I'd even lay down on the bed, she's just straight away said, this is about you. If at any point you don't feel comfortable, let me know and I will stop. If you need to take a breather, let me know. It's all about you and what you can tolerate. And I loved what she said. I loved her for that, because a lot of people, they've told me their horror stories where they just don't even close the curtains when they're doing it. They don't even ask if they want to have a chaperone in there. And you're absolutely allowed to ask for things like that. You're absolutely allowed to say, I don't feel comfortable with this, or can I have a different doctor? Normally it would be a woman that's doing it, but there might be a man. You can ask for a chaperone, you can ask for a female nurse. You're allowed to do that. You're allowed to take control and use the agency that you have to say, I don't like this or I like this. You're absolutely allowed to do that, right? So anyway, I just felt like I needed to do that public service announcement, because sometimes people feel shy, people don't feel like they can, because we see doctors as authority figures, and, you know, we give them their due respect, but at the same time, we also need to be able to set the boundaries when boundaries need to be set, right? So if you think you might be pregnant, they kind of advise that you don't do a cervical screening, because it can give you a risk of miscarriage. Because of the way that the whole process goes, where they use a speculum. FYI, that speculum was created by a racist medicine man. Why did I say medicine man? Racist doctor, James Marion Sims. Hold that thought, I'll come back to that thought. But anyway, so the whole process can be quite invasive. So they make sure you're not pregnant during that, because the nurse was like, if you do think you're pregnant, I can't do this because it causes risk of miscarriage. And I don't know if there's a way for pregnant people to get a smear test done. I saw a video from a woman from the Philippines, or who lived in America, have her smear test done, and she was heavily pregnant. So maybe there's like a whole different process. Again, I'm not a medical professional. Feel free to ask a medical professional. But from what I'd been told by my nurse who looked after me, she was like, yeah, I couldn't do it because it's the risk of miscarriage is too high. Avoid getting your HPV done 2 days before your period and 2 days after your period. I don't really know why. Maybe there's still some blood up in the womb and up in the cervix. That's probably, and that might mess with the samples. Maybe that's why. But yeah, they said avoid those 2 times. Whether or not you've been vaccinated against HPV virus, you still need to go and get your cervical screening. Yes. I got vaccinated when I was quite young. I was in secondary school. I think I had like 3 dosages or 2 dosages of it. I probably had 3. Where there was like a nurse, it was like a whole scheme. A nurse would come in, gave us the HPV, and it was bada bing, bada boom. And I know some aunties didn't let their children at that time get it done. I went to an all-girls school. Some mums had refused for some of my schoolmates to get it done because they thought that it would mean that they were having sex. Okay, so now this brings me to my next point. So whether or not you've been vaccinated, yes, please go and get your cervical screening. But this brings me to my next point. Sex happens in more than one way. It does. A lot of us have this idea that penetrative sex is the only way to contract things like STIs or HPV. That's because HPV happens through skin-to-skin contact, but it doesn't always have to be penetrative sex. You still need to do your cervical screening, because you can contract it through sharing things like sex toys. You can contract it through any of those type of sex that I mentioned. The whole idea of virginity is kind of it's kind of interesting to me. I actually don't even like the word virginity. I think I like to see it as a sexual debut, but it is what it is. And people think virginity you can only have your sexual debut in one way. So people think that it only has to happen through penetrative sex. But in my opinion, if you are having oral sex, anal sex, any other type of sex, I think you've already had your sexual debut. This is my personal opinion. If you're also part of the LGBTQ community, you still need to get your cervical screening. You are not exempt as well. So that whole idea of I'm a virgin, I don't need to get this done. Yeah, no, go and get it done. Get it done. I know some people might also be wary about getting it done if they are a virgin. You can ask for a smaller speculum to be used on you. The speculum is like a tool that they use to basically hold your vagina open. It sounds scary, and I won't lie to you, it was a little bit uncomfortable. It was. You can ask for a smaller speculum to be used if you're daunted. If you have things like vaginimosis, I can't say this word, or vagin. I'm going to put it on the screen so you guys can see what I'm trying to say. If you have things like that, I completely understand why you might be daunted by this. That condition, I'm going to put it there again, is a thing of the mind as well. You have to prepare your mind. They should be using lube with the speculum to hold your vagina open. If they're not doing that, then a small amount of lube at least, then they're a bit cruel. Because yeah, they're just a little bit cruel to you. So they hold it, so they use it to hold the vagina open, and then they put a brush just to collect the. So the way it went with me was, I had a conversation with the nurse. She asked me some few questions, and then she said, "You can go behind the curtains, undressed for waist down, lay on the bed, and let me know when you're ready." And she drew the curtains, and I laid there. And then she gave me tissues as she was walking in, and I didn't know why she was giving me tissue. I was like, why is she giving me tissue? Am I going to cry or something? Because I've heard so many horror stories, I thought it was going to be quite painful. So the way it went with me was, I had a conversation with the nurse. She asked me some few questions, and then she said, "You can go behind the curtains, undressed for waist down, lay on the bed, and let me know when you're ready." And she drew the curtains, and I laid there. And then she gave me tissues as she was walking in, and I didn't know why she was giving me tissue. I was like, why is she giving me tissue? Am I going to cry or something? Because I've heard so many horror stories, I thought it was going to be quite painful. So she gave me tissue, and she was like, "Okay, I'm going to go in and like just do what you need to do, like breathe or prepare yourself." And I have to do this when I get injections or anything. When I breathe in, and then the moment I know it's going to go in, I breathe out. So that's just what I had to do. And I think the speculum going in was a bit uncomfortable for me. I have to be honest with you. It was just a bit like, it wasn't like death shock horror scary, but it was a bit uncomfortable for me. And then she put the brush in, and it's so weird, I could hear the brush. But the brush, I thought that was going to be the most painful part, because I thought it was going to be scraping. Oh, sounds a bit harsh. I thought it was going to be scraping, but it was not. It was like, that was it. That was it. Literally, she swirled it, and then she put it in the sample pot, and that was literally it. And I was like, "Is that it?" And then she was like, "Yeah." And that wasn't even, the brush part was not painful. It was quite easy going for me. And then she put the speculum out. And then when I got up and I saw the lube on not the comfortable bed, the what's it called, the surgical bed, what are those things called? I saw the lube, and I was like, "Oh, okay." And I was like, "Is the tissue you gave me, is it for like," because she had the curtains drawn again when she left. I was like, "The tissue you gave me, is it for like the lube?" And she was like, "Yeah." I was like, "Okay, yeah." Then it made sense to use it to wipe, basically, yeah. I feel like this is the most intimate I've ever had going with you guys on my channel. And that was it. And I wore like a long skirt with slits on the side, so it would be easy for me to kind of have that process. I wouldn't advise you to wear jeans, but wear whatever you want, wear it. So yeah. So that was my experience, and it was just straightforward. If you are scared of losing your virginity because you're going to do the cervical screening, the thing is, some people, the whole idea of virginity is basically about the hymen, right? That's what people focus on. That's why everyone focuses more on penetrative sex, right? The hymen can still be intact even though you've had sexual contact, penetrative sex with other people, right? The hymen can still be intact through many different occasions where you might have had sex as we know it, right? But the hymen might be broken before you've actually had penetrative sex. My thoughts on virginity and losing it are quite, you might gather, is a bit different to the archaic thoughts on it. It's just a bit different. So, but like I said, you can ask for a smaller speculum, or you can wait. But that waiting might make the difference. Think about it, take your time through it. You don't always have to accept it, but I feel like for me, it's important to be able to do and make that choice and have that agency to be like, yeah, I'm going to go and check. Please make sure you look at the description box below. Even in my last video that I uploaded about driving, I really need you guys to make sure you're looking in the description box below for important links to NHS websites or articles that I think might be able to help you and contextualize this video fully, and also give you the medical background to anything I'm saying, because as I said, I am not a medical professional. So just a bonus part of this video. So years ago, I think 2018, I went to watch a play. And the play was centered around, it was created by a black woman actually. And she spoke about a scientist who's seen as the godfather of gynecology. And he basically created a speculum. But he's a racist man. Let me tell you why. So he created a speculum and he did lots of different reproductive experiments, and he would do his reproductive experiments without anesthesia on enslaved women. So he's come under a lot of rightful fire about the speculum, and some people have argued should we still be using the speculum. So many different like debates about that, but I just wanted to let people I just wanted to give that context as well to the speculum. But I think throughout the years it has been adapted and changed a little bit, but I still side eye that device. I'm not gonna lie. And out of the whole process for me, the insertion of the speculum was probably the uncomfortable part. It wasn't something I would be like, oh, I can't wait to get it done again. But the actual collecting of the samples was way easier and way, like, for me, I was okay with it. And I just don't want you guys to think that my experience is the norm. It is not always a norm. Some women absolutely hate it. If you have vaginismosis, English cry, that word. If you have it, then I understand why it sounds like the most daunting thing ever. If you have a terrible, terrible medical professional who's taken the samples from you, doesn't respect your boundaries, again, I understand that. And it's easier said than done, especially if you're a bit more shy, if you're a bit more reserved and you don't want to piss anyone off. It's like you want to just be a show and just be like, okay, but don't do that. Don't, because it's your body and you have every right to change your mind. I've blacklisted a doctor and my GP before, and I've told the reception, next time I call you guys, please do not give me that man. I never want to see him again. Not because of smear tests or anything. Sometimes it might not even be about advocating for ourselves, because shit people are going to be shit people, but I try to remove them from my sphere as much as possible, because I know the statistics are against me already, and I'm not trying to deal with it. So making sure you have someone that is really, really going to be caring and gentle with you for something that's such an intimate procedure. Very caring and very gentle with you is so key. You have the right to those things as well. Yeah, thank you so much for watching my video. I hope this video helps anyone who's got lots of questions. I had people in my DM asking me, like, how did my process go? Also people saying they'd had it done. People also saying that they were scared of doing it because of the times that we're living in right now. There's COVID. You might not feel comfortable going to the hospital. I completely understand and respect that completely. So I'm not going to say, oh, rush to the nearest hospital near you. If you want to like just wait, I get it, I respect it. The only reason I felt a bit more comfortable, because I did have those thoughts in my head, like, if I go now, I'm gonna go and collect COVID. But because my GP is smaller, and they don't see any COVID patients, and hopefully no one's going into the practice with COVID, and because it's a Saturday run clinic, so there's no one else there apart from people who are coming to do like blood works or smear tests. I felt okay to do it, and they're very, very, no one sits in the waiting room. You have to wait outside and go directly to the doctor's room. So I felt comfortable going in. I was speaking to someone in the DMs who was saying that, nah, right now I'm a bit scared, like, of going to the hospital because of COVID. But again, so many people are losing out on treatments and everything else because of COVID. So many cancer patients aren't being seen at the moment because of COVID. So anything that I can do at least to just help myself in a way, I'm gonna do it. But I completely respect your decision. If you're like, I don't want to go to hospital, or maybe the hospital near you is the highest rates of COVID in the country right now, I honestly, babes, more blame it, but at some point make it a priority. Do check the description box, because I leave information that I think might be useful or relevant to the video as well in there sometimes, not all the time, but I always do. So for the driving one, for this one, there will be irrelevant information from NHS and any other articles that I think might be useful for you. If you have any questions that you're a bit shy to ask me in regards to this, send me a message. I'll be more than happy to answer. What else was I gonna say? Yeah, happy smear testing. I'll see you guys in my next video, and make sure you subscribe. Share this video to anyone you think is relevant to. If you have any other 25-year-olds or coming up to 25-year-olds or 65-year-olds or 30-year-olds who have been like, yeah, share this video to them, okay? Anyone that you think might enjoy my channel as well, share it. Don't hide me now. I'm not your babes. I'm not your babes. Share me, okay? I'm joking. Thank you so much for watching, and I always appreciate all the love and support. Thank you. Bye.